And for our current members, we thank you for joining us this afternoon. And I know Kylie has put together a great agenda based on feedback from you. So we are presenting information that all of you have asked for, or you have asked a lot of questions about, and we thought it was a good opportunity to add it to the agenda. So this afternoon's agenda is chock full of a lot of information. Kylie, our benefit specialist, is going to cover this whole time of year, this open enrollment and any of the changes, and it is our on-site expert. So thanks, Kylie, for taking that part of the agenda. I haven't seen Brandon sign on. I'm assuming you're there.
He's here somewhere. I let him in.
Okay, Brandon Holt is our account manager from Excellus that we deal with on a daily basis and really focuses on the consortium and has our best interests in mind as far as claims adjudication, provider network, and everything else system related with your changes. But we joined Excellus this year for our pharmacy benefit manager. We had previously been with another company, and Brandon is going to bring us up to speed on the prescription benefit manager overview. We have another guest joining us this afternoon, someone new to our team this year as an outside consultant from Fox Point after our audit from the New York State Department of Financial Services. We found out we really needed some outside expertise to remain compliant with all of the cybersecurity and to protect all of your personal health information. We know that you manage some of that at your location. So we have asked Carl Cadrigari, how about that, Carl? Thank you, to join us this afternoon and talk to us about cybersecurity and protecting that personal health information. So I know Kylie has left some room in the agenda for questions and answers, but if there's something along the way, please raise your hand and let us know that we're not being clear, we need to be clear, or something just doesn't make sense. While I'm talking, Kylie is going to manage the chat room. And while Kylie is talking, wait, is that what I said? When I'm talking, Kylie manages. When she's talking, I manage.
You got it.
So with that said, welcome everybody. And we are going to start with the first agenda item. And it is an employer compliance review. Everybody can see that now? Good, thanks for the shaking of the heads. So my first comment about this presentation is a disclaimer. We are not giving legal advice this afternoon. We are not attorneys, nor do we have an attorney on staff. I think anything that comes up that you think might be a compliance issue for you and your municipality, you should seek to your resident expert, your municipal attorney, or your human resource person to make sure that you need to comply with this and you understand how to comply. So this is a very general overview of guidelines of notices and requirements that all employers should be following. The reason we put this together is through our conversations with you, our members, things like HIPAA have come up, or notifications, and people have said, well, I didn't know I was supposed to do that. How should I have known that I was supposed to do that? So we put together a really high-flying presentation to get you thinking about, are you in compliance? And if you aren't in compliance, what should you be thinking about to do to get your municipality in compliance with notifications specifically around your health plan? So this isn't total compliance. This is just health plan compliance. So there's a lot of federal, state, local laws, rules, and regulations that no matter your size, you must adhere to these compliance regulations. And failing to adhere to these laws may be costly to you. Some audits may just say be a correction audit. Some audits may cost you a fine, or in some situations, if an employee sues the organization, it may become part of a lawsuit, a costly lawsuit, that you were not providing this information to your employees when you should have been. So that's why we're alerting you, because there is some stuff at risk here. There's several different types of compliance. When new hires come on board, there's the information that you need to share with new hires at the time of enrollment on the health plan. Once they become employees, annually, there are several notices that need to be distributed. We are going to recommend you do it as part of your open enrollment process, but you can also, some of them are also timely for other times of the year. And at termination, there are also things you need to notify your employees about. And usually those notifications are very time sensitive and can be very costly if you're not in compliance with it. And then there's just some general reporting based on your size of the organization that you need to either file an internal revenue form or do some other filing. And we'll go through them quickly. So notices insurance eligible employees should receive when enrollment is offered or upon enrollment. The first one is COBRA, which everybody laughs at because you're just starting this employee, you're just bringing them onto the plan, and you're giving a notice that says, hey, if you leave us, you're eligible to continue your coverage. But that's how COBRA law is written. And for those of you who are considered small group, so that you have less than 50 subscribers, the consortium handles that automatically for you. We have a contract with Lifetime Benefit Solutions, and just like your service that you left with Excellus, who took care of that for you, very similar with the consortium. Once someone goes into the database, that information notifies Lifetime Benefit Services, either that someone has been hired or someone has been terminated, that they send those notices out to your employees for you. So the information goes in the Excellus system, and that's how we know where to send it and when to send it at time of hire and at time of termination. Those notices need to be within the first 90 days of coverage. So usually in orientation, you hand that out, or when you do your benefits orientation as part of the benefits package. In addition to that, when someone's hired, you need to provide them with the consortium's notice of privacy practices. There are links to them, and Kylie will share all these links after the presentation today. I did forget to notify Kylie this morning that the next link does not link properly. So we need to change that before we send it to you. This takes you to a different topic. So HIPAA, that should be distributed to your employees within 60 days of any material changes, or every 3 years. So if the plan changes significantly, that would be a material change. Or if everything's going according to plan, they should get those notices at least every 3 years. You may want to give them every year, just to be safe. We are going to update that notification early next year because there have been some new mandates that have come out regarding privacy practices, and we'll notify you when we make those changes. HIPAA notice of special enrollment rights. This should also be sent out with the initial enrollment period. And there's samples of a very nicely written notice from the government about your options when you can join and rejoin health insurance plans. And that sample is nice and clear on that. Medicare Part D credible coverage. There's an annual requirement that we'll talk about a little bit later, but this should also be given to all new hires, letting them know that all consortium drug plans are considered credible coverage. There is modeled notice letters also available online regarding notifying your employees that we are Medical Part D is the prescription drug part of Medicare, and people can waive that if they are in a plan that has credible coverage, which we do. Other things specifically regarding yes. Oh, I thought there was a question. Okay, other things specific to us that we have, we prepare for you and is available to you on the website under your municipality. Every open enrollment, or at least 30 days prior to start of the plan year, if people are automatically enrolling, you are supposed to supply the summary benefit coverage. If there's a special enrollment, you're supposed to set it out at that time as well if there's a change mid-year, and it's and or if someone requests it, you're supposed to give it to them within 7 days of that request. Those forms, if you're familiar with our website and you're part of the website, there is the plan that everybody's on. There's a column to the right and a column to the left. Most people click on the summary plan description, which we'll talk about in a second, because on the right is the summary benefit coverage. It's a summary of everything that's covered in the specific plan, deductible, out-of-pocket maximums. There is just a lot of verbiage in the summary benefit coverage, and it doesn't go line by line what is covered. What goes line by line of what is covered is what we use when we're bringing new groups on to show them any disruption of coverage. Is that summary plan description? No, I'm wrong for a second here. The summary plan description is not in the right-hand column. The summary of benefits is in the left-hand column. That's the one that goes line by line. Summary benefit of coverage is in the right-hand column. So those two are on the website. But the second thing that is required, one of the top ones is not required. The third document I'm talking about is the summary plan description. That is what we have approved by the Department of Financial Services when we make any changes to our plan. So this year we have 2 New York State mandates, one regarding insulin, the other regarding birth control. We have to put those into the document. This is a very, very lengthy document. It talks about every single thing in great detail. It is not like the summaries that we provide on your municipal site. It is on a specific site called Plan Documents within our website, and it's a huge book. You are required to offer a printed version to all your employees. Otherwise, we suggest, since you don't want to print out books for open enrollment, that somewhere in your open enrollment, you provide a hyperlink to our website so that employees know that they can get a full description of all benefits. So we actually have 3 different documents. The nice summary that Excellus does for us, showing us line by line, then that summary benefit of coverage with a little more written verbiage, and then the whole entire plan. All of those should be eligible to your employees, especially upon request. The other thing not related to us that should be part of your annual notifications is the Women's Health and Cancer Rights Act enrollment notices. So this is an annual notice. It describes required benefits for mastectomies, related reconstruction, surgery, prosthesis, and treatment of physical complications based on mastectomies. And there is a nice sample notice that the government provides regarding that. And you should be handing that out annually. So a lot of people just include that in their open enrollment. In addition, all new employees should get the Children's Health Insurance Program Reauthorization Act notification. And that is letting the employee or the dependent that they can request coverage within 60 days of being terminated from Medicaid or CHIP coverage, within 60 days of being determined to be eligible for premium assistance. And since income levels change based on employee status, this is an important one to know about. Even if you think someone probably may not qualify for it, you still need to give them this notification that they may be eligible for assistance. The other is notification of the New York exchanges that even though they are offered health insurance through us or through you, you may still have other coverage options through the health insurance marketplace, which we know was created during the Affordable Care Act. And those are also supposed to be handed out within 14 days of enrollment. So a lot of notices when employees are hired. And here are the notices that you should be distributing on an annual basis. So you notify them when they're hired, and then you keep notifying them every year. I don't make up these laws, but it is a requirement. So we talked about the HIPAA notification. This is for the privacy practices. And that should be distributed annually. Most do it during the open enrollment. The summary of benefits coverage, summary of benefits and coverage, those 2 things I talked about on our website. We update them. We usually do not have them available until December, just because it takes a lot to update those with any new mandates, with any changes we have made, with any changes Excellus has made. So they come out usually in December, and I know what you're saying. Hey, I've got open enrollment coming out. I want these for open enrollment. We usually advise you that you can use the current year. And then Kylie's going to talk about the changes that are going to happen for next year. So you can notify them in open enrollment with some supplemental material, what is changing to the current form they have, and then let them know that those will be available with that link come December. So if there are no benefit changes, the current summaries remain in place. The Medicare Part D credible coverage needs to be distributed prior to October 15th of each year. So it's prior to the individual's initial enrollment period in Part D. So this is to Medicare eligible. Medicare eligible, either age or disability. So that's what this notice is about. So it's that specific group and needs to be sent to them prior to October 15th. And then any amendments, well, I talked about this a little bit already. We send those edits to the Department of Financial Services and we wait for them to approve them, and then we notify you when they are up on our website. And just so you know, that is a very long, time-consuming process. But we badger the Department of Financial Services to get them to us as soon as possible. We already talked about the women's health and cancer rights, that you give that to someone upon hire. You also would give that to them annually as part of the open enrollment process would be fine. Same thing with the CHIPRA. Because living situations and income changes, we have to let everybody know from year to year that that may be an option for them, for their children. Okay, here's a notification that most of you probably don't need, but those of you that have a wellness program where a wellness program with incentives where you are collecting personal information, personal health information, PHI. For example, people who participate in the Blue for You clinics, you may not be collecting the PHI yourself, but you are securing a company that is collecting PHI on your behalf. So you may be required to notify your employees of this collection of personal health information due to a biometric screenings, which is usually when you're collecting PHI. So even though that information doesn't go to the employer, you have a program that is collecting that information, and a wellness incentive is based on that. So we really encourage you to look into this one if you have a wellness incentive program. And your notification may say, as part of the XYZ company, we do not have any access to PHI. However, IH21 collects that information for us as part of the wellness program. And here is how IH21 keeps that information confidential and secure on your behalf, the employee. So we do recommend, if you're doing that program, to please look into this. There are a few things that are not applicable to the consortium, and we get questions about it because usually when there's a change, and you're reading about it in the news, it'll say something like excluding grandfathered plans. Or it'll say some other things, like the patient protection disclosure notice, and you'll think, am I doing that? Should I be doing that? These notifications, so a summary annual report is part of a ERISA program. Grandfathered status, there are plans that are called grandfathered plans, or this patient protection disclosure. Those are, the patient protection disclosure is if a plan requires you to select a primary care physician. And as you know, none of our plans require that. So these do not apply to us. We do get asked about them from time to time, and just wanted to say, not us. So, and when employees terminate, what do you have to notify them about? And 3 of the 4 boxes are notifications. One is the health with the health consortium. We do not manage your dental or your vision. If you have a dental and a vision plan, you are probably required to give COBRA notifications when those coverages end or terminate at the end of employment. And you should be sending them COBRA notifications and how they can continue their COBRA as part of that. So COBRA notification will go out to all our small groups automatically when you input the termination date. So Kylie will make this pitch and I'll make this pitch here. Please get those termination forms to Kylie as soon as possible, because when your employee terminates, the clock starts ticking on COBRA notification. And if the notification doesn't go into the employee late, the clock remains ticking on how long they have to make an election. So COBRA is something very timely. Our large employers above 50, most of you know about COBRA, and most of you are doing them, and you issue your own notices within 44 days of the termination. Most of you do it with much less than that time. The upper right-hand box is for fully insured life insurance plans that you can take with you. And I know some of you offer fully insured life insurance plans. So you should contact those insurance companies and say, hey, should I have a conversion portability notice? Should I be sending that out? Or should you, my fully insured insurance company, are you sending those out to our employees upon termination? So that's something that an employee is portable, not part of the consortium, but may be part of your employee group. There are some reporting requirements. The ERISA form 5500, you'll hear a lot of talk about that if you attend a benefit seminar with an outside organization that has a lot of ERISA plans also attending. This is not applicable to us. So form 5500, not applicable to us, whether you have 100 or employees or not. W-2 reporting, yes, is applicable to us. I'll talk a little bit more about that on the next slide. That's if you are doing imputed income for life insurance, domestic partners, dependent care benefits, and we'll talk about that in a little bit. We talked a little bit about the credible coverage and the section 6055 and 60 the Internal Revenue Code 6055 and 6056. No, I don't have, I have to talk more about it on this slide. I thought I had another slide on this. Okay, so let's go back to W-2 reporting. If a domestic partner is covered and you are doing tax-free premiums, so tax deferred income for the amount you deduct for benefit premium, a domestic partner is not supposed to be taxed. So there is additional W-2 reporting. There are also some other imputed income for other benefits that are, if you are an employer-sponsored plan, your payroll department, your finance department should be aware of what aren't tax-deferred benefits, and you should be reporting it on their W-2. I know Tompkins County has a formula that they use regarding domestic partners. And that is something that a lot of times is overlooked. And should you be audited, should you have a financial audit, especially your payroll and W-2, are you taxing on these benefits? And the answer is yes. You should make sure you know how to report those premiums properly. The Medicare Part D credible coverage, there are two parts to that. The employer reports to the Centers for Medicare and Medicaid Services, so to CMS, must report, but Excellus reports that on behalf of the consortium. Since all our plans provide credible coverage, that is reported on our behalf. Thank you, Excellus. What the employer is responsible for is if you are providing minimal essential coverage to an individual, you must report to the IRS and furnish a statement to those individuals. So the plan level, then the employer level, then the employee level. So the employee, you are either reporting on a 1095B, or I think it's 1095B or C, depending on your size, is how you are reporting. Yeah, 1094B, 1095B, depending on if you're above 50 or below 50, how you have to report that. And that's each year. So that's letting everyone know you have credible coverage. And that started with the Affordable Care Act. And everybody sends those forms to their accountant, and their accountant says, I don't really need to see the form, I just need to know. So the other thing that if you are converting to the consortium, somewhere along the line, you are going to get a PCORI notification fee, and you usually send it to us and say, do I have to pay this? People who have been with the consortium for years never get this PCORI fee. It is a yearly fee that is adjusted on an annual basis. Each year, the percentage goes up. The consortium pays PCORI fees on your behalf. So, and you will see it on our expense line. If you ever get a PCORI notice, please let us know. A lot of times your previous brokers will say something to you about the PCORI fee. We will look at the form you have received and let you know if it's applying to your current plan or if it's for your previous plan. The other thing you should have in place, if you have a health spending account, a health reimbursement account, you have pre-tax dollars coming out of paychecks, you should have a formal Section 125 plan written. It's called the cafeteria plan. It gives employees the choice between a taxable benefit, a qualified benefit, and you must have a plan. A lot of the consultants that manage your HRAs, FSAs, they will do this for you. But just make sure they are creating a Section 125 plan for you. If you have a buyout program, anything that's regarding cash or taxable, tax deferred benefits, you need to have a Section 125 plan in place. So that is a really quick review of compliance issues that are related to you offering this self-funded health plan through the consortium. So we flew through a lot of things. I'm not expecting anyone to become an expert today. I didn't go into great details. Like I said, we are not an attorney, but we are happy to answer your questions. Should you say, hey, this came up, I don't know if I should notify my employees or not. Where online did you say is a good resource for us? We are more than happy to point you in the right direction. We will not give you legal advice, like we won't build a 125 plan for you. But we will say, here's a resource for you that can probably answer more questions for you. But I also refer you back to your own either in-house or contracted attorney for the municipality, because they probably have resources available to you as well. Now I see there's a ton of stuff going on in the chat room. Kylie, was there anything I needed to look at there or answer?
No, I answered the questions as they kind of came in. I would encourage people to kind of check out the chat because there were some great questions in here about, when do I have to issue the credible coverage letters? Is it just for retirees? It's not, it's anyone who's eligible for Medicare. A few questions came in about, will these slides be available after the training? Which, yes, after each training, we email out all of our slide decks as well as a hyperlink to the recording if you want to revisit or share with other staff this training. We do understand that we cover a lot of material in a short amount of time, so review never hurts. But yeah, I did answer most of the questions in the chat.
Right, thanks. All right, Kylie, I turn it back over to you.
I was going to say, I'm going to take it away now. All right, so the next section is all about open enrollment and upcoming changes for the consortium coming 2025. So I will forewarn you, I'm going to make sure everyone's awake. So I do have some polling questions throughout my presentation just to make sure that you're click ready and to make sure that we still have your attention. So I'm Kylie Rodriguez. I'm the benefits specialist here at the consortium. I hope you think of me as a resource. So if you ever have questions about claims, benefits, prior authorizations, you want to compare plans, anything like that or along those lines, or if you have members that really just need some extra assistance with their discussions of what's going on with their healthcare needs, feel free to send them my way. This is all my direct contact information. This is my direct email, my direct phone number. You're welcome to give it out to whoever you need to. We try to be as accessible as possible for you. So very briefly, these are the topics that I'll be covering today. I'm going to kind of do a broad overview of what open enrollment is and how it happens every year. I will go over the consortium updates for 2025, including premium rates and benefit updates, as well as some additional programs that we may have gone over in the past. We do have some of our new municipalities on with us today, so I just want to go over those again real quickly, as well as reviewing how to make municipality updates with us and some tips and tricks for enrollment and billing. Again, just as Elin said, feel free to interrupt at any time with questions. You can raise your hand, you can throw it in the chat. We always love questions during presentations. It really makes it a lot more interactive. So every year, you are legally obligated as an employer who offers health insurance to host an annual election period or open enrollment to all of your employees who are eligible for health insurance, whether they're on or off the plan. And this is where you would send out benefit information as well as encourage updates to their enrollment. So one of the things we always tell our municipalities, open enrollment is a great time to just double check those dependents, make sure that who's on the plan should be on the plan. You know, do you have an employee who went through a divorce and they just left their ex-spouse on their coverage, but they don't need to? Do they have children who now are working on their own and have their own health insurance? Do they need to maintain coverage? Those types of, questions or updates are important to happen during open enrollment, because there is no, like other times of year where you need a special enrollment period to make changes. Open enrollment is that chance to kind of update and refresh everything for the new year. So then any changes that happen during open enrollment would be effective January 1, 2025. We normally recommend hosting open enrollment November 1st through November 30th. You can start it earlier. I know some of our bigger municipalities, they have a big employee group to work through. So they normally start it in October, but as long as everything's wrapping up by November 30th. Any late data entry into December, we can't guarantee that members will get their cards on time. We can't guarantee that those plan changes will be up and running by January 1. So we really want to make sure that all the data entry is completed by November 30th at the latest. Okay, I warned you, so here comes our first poll. This is just a quick testing your knowledge type thing. Let me just find where my polls disappeared to. That's not it. You have to love when Zoom moves all your stuff around. Makes it so much easier to have presentations going. All right, our first poll. Can everybody see that? Yes, people are voting, so I'm assuming yes. Okay, so the first poll is, an employee's daughter who's a dependent on their coverage has a baby. Is the baby eligible for coverage? Yes or no? And I'll just give it a second here for some people to vote on in. Okay, so we've reached kind of stable numbers here, which honestly is yes is at 51% and no is at 49%. So I'll just share those results real quick for you. And the answer is no, the baby would not be qualified for benefits. Not unless the subscriber, who would then be the grandparent, has legal custody or rights to the child. Just because a dependent on the plan has another dependent doesn't mean that grandchild would be covered under the plan. They would have to seek out coverage through like New York State of Health or perhaps another avenue if the parent is working and has health insurance options. So this is who can be covered by the plan. So obviously employees, employee spouses, or domestic partners. Dependents include children, natural, adopted, or stepchildren, as well as domestic partner children. And we encourage all of our municipalities to make sure that they're verifying the dependents qualify. So that's getting a copy of a birth certificate. That's getting a domestic partner affidavit completed. Those are all things that we don't need here at the consortium. Those are things that you would keep on your records back at the municipality. But it is an important part to help make sure that we at the consortium are covering people who are eligible and should be covered, and we're paying claims on the people who should have that coverage. And then, of course, any changes or updates to dependents, you would complete an enrollment form Small groups directly submit that to the consortium through the subscriber portal, and large groups directly enter that into the Excellus website where they have access. So one of the tools that I always, well, you'll see when you start emailing me questions, is emailing us our website. Was there a question?
Yes. Can you hear me?
Yes, Denise.
So the question I have, because you was talking about, what was it? The having the actual document for, whether it's a domestic partner, you said affidavit. Don't we actually need a certificate or the marriage license? The reason I asked that is because we had an employee who got married and they had their, at the wedding, they sign off, but because it didn't get registered at the city clerk's office, they weren't considered married. So do we need the actual marriage license or certificate, or you said affidavit would work?
So an affidavit is for a domestic partner. So a
No,
marriage.
I know that. I know that, but I'm just saying, because does it matter whether it's the affidavit or certificate? Is there a difference between the two?
Yes. So for a marriage, you would want the marriage certificate.
No, I'm sorry. I know about marriage. I don't need marriage. I'm talking about the affidavit and certificate for a domestic partner. Because can a person go get and sign all those, the paperwork and get it notarized, but don't get the certificate?
Yes, it's one or the other. Because either one needs to be notarized, but yes, and I can send it out. We have a member verification form. It's just a guide. It's not something that needs to be completed, but the last page is the documentation requirements, the legal documentation requirements to provide to your employer for domestic partner coverage. So I can send the guidelines for that documentation.
Okay. No, I have it. I was just asking because of the bit with the marriage license. When they come back and told me that they weren't married because they wasn't registered and they got married, I just wondered if the affidavit was the same thing, but thank you.
Yeah, they kind of can be interchangeable with domestic partner, but you're right, with a marriage, it really needs to be certified. Oh, and Sarah from Tompkins County chimed in on the chat saying the county has an affidavit, but we also accept official certificates. So yes, it can be either or.
Thank you.
So our website is set up so the consortium is very transparent. You can go on here, feel free to click on anything. There's lots of resources here for your employees, your retirees, as well as you as a benefit clerk. Most of the benefit clerk resources you'll find are their municipal resource tab. But as was mentioned earlier, and the hyperlinks were in Elyn's presentation, to find where your benefit summaries and summary of benefits are, you'd go under the employee, retiree, and then go by municipality to find your documents. So I'm sure everyone's wondering what's changing for next year. So I'm going to dive into it for you. One of the things I want
Kylie, before you jump in, because I need you to answer, or Brandon to answer, when can large groups begin making changes on the Excellus website? And I don't know if we have a dark out period yet this year.
You mean when for open enrollment, when can they start making changes for 2025?
Yes.
When you should be, so when you're making changes, you should be selecting open enrollment as the option. And then you'd be putting in that effective date of January 1. I believe we can start doing the entering the data now. And then it will continue on through the blackout period, which I hate calling it that, because most of the time you can still do data entry. It's beyond the point of guaranteeing cards will be to your member on time. Everything's set to go January 1. There's no guarantee after that date. Normally we say get your data entry in by November 30th, because that first week in December is our wiggle room. Okay, so that's we just had an employee walk into our office and forgot to turn in their enrollment form and they're adding 5 children. That's okay. You have wiggle room that first week in December, but pretty much that first Friday in December is the blackout period where we know Excellus can no longer guarantee cards and things like that. But if Brandon or Sean want to chime in on this one, they're more than welcome to.
Yeah, I think there's essentially no blackout period. I think she's thinking back to last year when we advised not to make any changes in terms of moving members because we were changing all of the plans with the introduction of the prescription drug benefit. So unless you are moving an individual to a plan that does not exist today or is potentially going away, if you have a plan that's in place that's offered to employees currently and that is going to be in place and offered for January 1st of 2025, you're free to kind of move those members around if that's what you're asking, Sarah. You know, last year, Kylie, we had advised not to make changes within a certain period while we were making the plan changes. So I think that's where the question's coming from.
Yep, and I think you're exactly right. Sarah kind of chimed back in saying 1 year Excellus had a blackout period in October or November, which we didn't know about, and then none of our changes went through, which I think was more of a system glitch, not last year. If there isn't one this year, that's great. Typically, there shouldn't be a blackout period like Brandon was saying. It's just we were updating some plan structure to make us run more efficiently on the back end.
Yeah, 2 years ago it was all the group structure changes where we had some things that dropped through. So she might be referring to that as well. So the last 2 years we've had some periods where some activity shouldn't have occurred, but this year we have kind of neither of those things going on. So there should be no blackout period. I don't expect there to be one for OE of this year.
And one of the questions from Bridget from Town of Irwin is they're hosting an open enrollment, but if there's no new enrollees or no changes, do we need to be notified? I love getting emails saying no changes, but you don't have to. It is kind of nice to keep us updated. I monitor the subscriber portal on a daily basis and get those data entries in as quickly as possible during open enrollment for our small municipalities. So you're always welcome to communicate with me how it's going, or if you need further assistance during that open enrollment period. Any other questions about open enrollment or hosting an open enrollment? Elin kind of did go over that idea of what needs to be given out, such as the benefit summaries. You're going to want to give them updates on any plan changes, as well as offering an enrollment form so they could complete changes if they have any. Okay, I'm gonna skip on into plan changes. So first up is premium. I did want to mention that in the last 5 years, the average premium increase for the consortium has been 7.7%. For 2025, we are looking at making a double-digit jump in premium to a 14% increase in 2025. I know this is a high number. It was voted on by our board of directors in September, and we did run some numbers. So as you'll see here in kind of the blue and the purple, these are our metal level plans with the consortium. This includes the 14% increase for 2025. And we compared it to the metal level plans that are comparable in the community rated with Excellus. And as you can see, like our platinum single is at $955.78, and their platinum single would be at $1,214.46. So there is cost savings still with the consortium. And the biggest question we've been getting lately is why was there such a drastic increase in our premiums? And our claims have escalated over the last 2 years. 2023 was where we really started to see that pitch up, and it's just continued through 2024, where we've been using reserves to pay claims to balance out our premium revenue and our claims expenses, and to kind of right the ship and put us back on a steady course. A higher premium increase was needed to kind of offset that drastic increase in claims that we're seeing across the consortium's membership. One of the questions in the chat was, so the municipality can pick any open enrollment dates as long as it's done and entered by November 30th. That is correct. So I have some municipalities that, only want it open for 2 weeks. So they're not waiting and waiting to get back things. I have others who say, I'm going to give a full 30 days. So I have time to follow up with my employees or maybe even have a benefit presentation for them. But yes, anytime as long as you get everything in by November 30th. So I did put this in here. I know it is not all of our premium rates for 2025. We do have some municipalities that are on our older indemnity plans and our PPO plans. All of our premium rates to our existing members were emailed out last week from Terry, our finance manager, for your direct municipality. So you have those rate increases already with your bookkeepers. But I did want to include this slide that includes our metal level plans, as well as our 2 Medicare supplement plans, so you're aware of the rate increases for next year. So when it comes to plan benefit changes, one of the nice things about this year is during our actuarial value study, it was found that we don't require any actuarial value changes. Actuarial value changes are not something that we set. So Centers for Medicare and Medicaid Services has certain parameters that our metal level plans have to fall into. And it's a percentage of benefit that gives our platinum, gold, and silver have like a 2% give or take. Bronze has a 5% give and a 2% take. And they have to fall in that certain percentage parameter. And if they don't, we then have to make plan changes to fit within the actuarial values set by CMS. Luckily, for this year, we did not have to make changes due to that requirement. We still fell in with all the parameters of keeping all the high deductible plans, their deductibles and maximum out of pockets are staying the same. So we did not have to adjust, which is great. So the big piece we looked at for plan benefits moving forward into 2025 is we took into consideration, Joint Committee has been very vocal about making sure that we have increased mental health support and access to care. We wanted to decrease out-of-pocket costs for virtual care and adjusting some of our visit limits that we currently had set on our plans to be more competitive with Excellus plans as we continue to market new members in the future, which is what all of these things were taken into account when the plan changes were proposed and then eventually voted on and will be implemented in 2025. So these are the 2025 plan changes. The top 3 only affect metal level plans, and the bottom 2 are mandates that came out from New York State. Because we are an Article 47 consortium, we have to follow all federal and New York State insurance mandates, and therefore we have to comply. We don't have a choice on these benefits. They have to be part of all of our plan offerings. So one of the changes for our metal level plans was increasing the skilled nursing facility visit limit. In this year, it was 45 days per year. Next year, it will start to be 200 days per year, which matches most open market Excellus plans. And then we also shifted MD Live, which is a telehealth service offered to all of the Excellus plans that we carry. For only our metal level plans, we've shifted from that being a copay or coinsurance to covered in full. Now, if it's a high deductible plan, like our gold, silver, or bronze, you will still need to meet that high deductible first, but once it's met, those visits would be covered in full. I will say this is a great way to open access to care. You can have an app on your phone, you can call and make an appointment, you can go on your desktop or your laptop or your tablet and go online and have an online account. It's very easy to set up an account and set up an appointment. And it can be used for, I have a rash and I just want to get on some steroids to get rid of it, to I really could use a behavioral health visit, but I can't find anyone within a 20-mile radius of where I live. You can also do behavioral health appointments through MD Live. They try to schedule you with the same provider every behavioral health appointment, so you can build that trust and that relationship that's involved in that type of care. And normally you can get an appointment within a couple of days for a behavioral health appointment. So definitely a great opening up of access to care and kind of limiting that out-of-pocket cost that would be incurred with it as well. The other benefit that will be increasing in 2025 is adult eyewear allowances for all of our meta level plans. We're shifting from a $60 allowance to a $100 allowance per year to be more competitive with the Excellus plans that are on the market that currently allow a $100 allowance for adult eyewear. Again, for the gold and the silver and the bronze, you will need to meet your deductible first to then have that benefit. So the mandates, one of the mandates that came out very late in 2024, well, came out 2024, 2025, we've already implemented, but just to make it clear that it's on all of our plans, is a birth control refill mandate. So originally you could fill your medication for a 30, 60, 90-day fill. The mandate now says you should be able to get a 12-month fill of your birth control for a single purchase. Your doctor, of course, would have to write the prescription that way and send it to the pharmacy, but that is now available on all the consortium's prescription plans. And then the final mandate that came out that takes effect January 1, 2025 is the insulin cost share mandate from New York State. In the past, our insulin benefit has been to follow the drug formulary. So whatever tier the insulin is in, tier 2, tier 3, that is your copay rate for that medication. Starting in 2025, there will be no copays for all insulins on our formulary. I'm just checking the chat here. Elon's got it. The question was, eyewear increases only for meta level plans, not PPO. No, there was no, the only shifts for PPO plans was the addition of the refills for birth control and the New York State insulin mandate. Those are the only changes that would affect the older style PPO plans and the classic blue plans, as well as our Medicare supplement plans. Another question was no copay for insulin until your deductible is met, or no copay at all? Great question. That's where I was going with this slide. I love it. You're leading me right along. There are no cost shares, which means the deductible, if you're on a high deductible plan, will not apply to your insulin. Co-insurance and copays will not apply to the insulin. It will be a $0 amount. So
I got a question again. I'm sorry.
Yeah, go ahead.
I want to make sure I heard you right. So the 14% increase, is that just for the platinum plan, the metal plans, or is it for our classic blue too?
14% is across the board on all of our consortium plans.
Okay, all right. Well, hey, just a suggestion, because it seems like other companies are raising their rates across the board, but our salary's not increasing. So one of the things I would just encourage the consortium to do is just make sure they do that, be consistent each year, as opposed to giving us this big increase in 1 year, because that's a hard hit.
Yes, and we know it is. Elin, I'm not sure if you want to chime in on this one.
Can I chime in on that? So for those who were able to attend the board meeting, I know a lot of this group does not. Warden Hart, our chair, spoke about that. That is the mission of the consortium, is rate stability. And we have been, as Kylie showed on a previous slide, that we have been lower than 6% average since inception. And this year we made a double-digit adjustment. So two things are involved in that. One, we have built our reserves up to a significant level. The board had made some decisions in the last 5 years that started chipping away at some of our voluntary reserves. Normally, we would use those reserves to supplement any spike in an increase. We don't have those reserves because we have been using those reserves. So we still have reserves. They're just not at a 18% level. They're now below a 5% level. So when we have reserves between 12% and 18%, we can use those reserves to keep our rates stable. When we start getting below that, we are using those reserves to pay for the high claims. So one thing is, the board has made decisions in the past 5 years that has affected our overall reserve status and inability to use reserves this year to counteract any increases in premiums. The second thing, even if we did have 18% in reserves available to us, cost of claims are going up significantly. The consortium is not the only organization that is increasing claims. National premiums, national trends of claim cost is around 8%. Excellus in this region is around 10%. Excellus is averaging a increase at around 12%. They put into the Department of Financial Services that they really needed a 19% increase, as did several other large insurance companies. So what is driving the cost of claims? One is inflation. Medical care, all the supplies, everything related to the cost of care is going up. It's going up everywhere. The other is new technology coming in to medical care. So all those great robotic systems, all of the technology that you wear on your body that notifies your doctor without you having to go in, all of that costs a lot of money. In addition to that, prescription drugs are out of this world. Every commercial you watch, those drugs are not cheap. Specialty drugs that are very costly to us, those represent about 80% of our total costs of our prescription drugs. So we're averaging over $3,000 per member per year on prescription drugs alone. So cost of care is going up. In this area, we are seeing increased cost of care for the diabetic population, so care around diabetes, cancer care, very costly. And also there's still going on a lot of muscular skeletal changes, knee transplants, hips, whatever, that may have been delayed care due to the pandemic, but this region is especially seeing a lot of knee and hip replacements. That has affected our claims significantly. So we were over budget by 5 million last year. That carries over into this year, and we continue to perform above budget. So I think 11 out of the last 18 months, we have seen claims exceed the amount of premiums that we are collecting. So this isn't the consortium just decided that this year we should increase premiums double digit to catch up. It's the high cost of claims are hitting us. And they are hitting us consistently. So we didn't have just one person have a catastrophic claims last year. The whole boat is rising, and us, Excellus, Aetna, everybody else in the market is having to rise along with it. And Kylie and I can send out some articles regarding the high cost of care and what's happening in the marketplace, because we've been doing a lot of research on it, as well as Excellus sharing a lot of information with us. So that's kind of how our premiums ended up where they are. It's totally based on experience, 95 cents of every dollar spent with the consortium specifically goes to pay claims. So we're not, adding staff and charging more on premiums. We don't have a big marketing program. We don't have a TV program. It's strictly going to pay those claims.
All right, for the sake of time, I'm gonna just keep moving forward. Please keep asking questions if you have them. So one of the things I always like to point out is just to remember that we have a direct Excellus customer service line for our members. So if they go online and they Google Excellus customer service, they're gonna get a 1-800 number. I can almost quote it for you because I spent too many of my years dialing it for a previous job, but that is not the number they want to call. The number they want to call for Excellus customer service is on the back of their card or right here in front of you, the 1877 number. This customer service line really has our plans nailed down. They have a better understanding of who we are as the consortium. If you're a large group municipality, you also have access to call on behalf of your members. And they have you on record as being able to call on a member's behalf and verifying that. Otherwise, if you just call the regular 1-800 number, you may be tossed around a little bit until you get someone who can really provide you the information that you're looking for. As always, please think of us as a resource as well. I'm always happy to handle and investigate any member issues for you, and work with your members directly if that's something that you prefer, and just keep you in the loop once it's been resolved. We just want to make sure that you know that you're supported by Excellus and by the consortium. Again, this is a link to the plan information by municipality if you need to go on and print off new benefit summaries or summaries of benefits, which of course all these hyperlinks are active and will be sent out in the slide deck. We try to be as accessible as possible. I'm willing to come out to benefit fairs, wellness fairs, do open enrollment sessions, meet with your union groups if you're in negotiations and they want someone from the health insurance to come out and talk benefits. All of those things we're willing to do, so feel free to reach out anytime. All right, another Zoom poll to make sure we're all awake here. Okay, give me 1 second here. All right, so the next poll is, when is the wellness email sent out to our municipal members? Every quarter, at the beginning of the month, when needed, or upon request? And I asked this question to kind of get it on your radar, that we do send out wellness emails as a way to encourage participation in our voluntary wellness program to all of your subscribers. Just giving you a half a minute to click in and answer. All right, so 38% said every quarter, 63% said at the beginning of the month. So for 2024, we typically send it out at the beginning of every month to make sure that you're getting that wellness information out there early in the month so you can help promote our wellness challenges and encourage participation in such things as our flu clinics or our Blue for You clinics, which is those biometric screenings that are done on site at various municipalities throughout our region. And then we also encourage people to check back in and follow and like our Facebook page, where we do a deeper dive into each wellness topic of each month. Now, coming up for 2025, we're going to shift that communication a little bit, where wellness emails, which really have focused topics and articles and things, will be sent out every other month. And the in-between months will be more about promoting participation in different education series we have planned, challenges we have planned for next year. We're even kicking off a wellness book club where we will be providing books to participants, as well as an interactive Facebook group for reading through some of these wellness materials. So trying to be more interactive with our subscribers and encouraging wellness in your employees. I have tons of statistics on, attendance and things like that for that return on investment for wellness programs, but it really is there. It's not just about keeping your employees healthy. It's also about maintaining your workforce, and assist in keeping our claims, lower as well.
Well,
Check.
thank you.
Kylie, can I ask a quick question
I'll
about
get
this?
you a receipt. What's that?
Did I write it correctly?
Yeah.
Sure, one
hopefully.
second. Let me just mute Michael. What was the question?
Yeah, can you just, are these emails sent to just the benefit clerks that we need to forward them to all employees? I guess I always want to verify I'm not sending things twice to employees.
Right. So the wellness emails are sent to benefit clerks. And then some of the larger municipalities have wellness champions designated, so they also get the email. But the expectation is that it's being forwarded on to all of the employees. We are working on kind of developing a listserv where employees could register directly to be sent the emails. But I'm not going to lie, I don't think it hurts to get wellness information twice, because sometimes they skip over it the first time but may read it the second time. But the expectation is that benefit clerks would be forwarding on that information to their staff.
Thank you, I appreciate it.
Another one of the services that was kind of touched on by Elin in her presentation is that COBRA administration for our small groups, where, once you submit in a termination to the consortium, we do have a couple small groups that still do direct entry, but once that's submitted in, then the COBRA notices are generated and mailed directly to the ex-employee to offer them the option of joining COBRA coverage. And then Lifetime Benefit Solutions, who we contract with for this service, would also bill the COBRA premiums to the member. We do tack on a 2% administration fee to our COBRA rates for small group to help with the administration cost. And it's allowable by COBRA laws and rules. And then once LBS receives those payments for the COBRA, those payments are then issued back out to the municipality of the COBRA enrollee. So it's kind of a money transfer. The money comes back to the municipality, and we, the consortium, keep billing you for that COBRA enrollee. So money comes back to the municipality, but then the money comes back out from the municipality to the consortium to pay for that COBRA enrollment. And of course, I always get asked, well, am I small group? So these are all of our small group municipal members. All the ones in kind of a goldish yellow are actually new municipalities joining the consortium for 2025 that would also be receiving this service. Another service is, because the consortium is so large, last year we went out and we received more of a group rate from Total Care EAP, which is an employee assistance program that if you enroll through them, through your consortium membership, they offer a set pricing that may be lower than just going out and getting an individual contract. Currently, the pricing is $18.61 per employee per year. They have certain thresholds we have to meet for participants to get yet another lower rate. And we're a little bit below the next threshold by a couple hundred enrollees. But this is a great program as we're looking to, we hear a lot from municipalities talking about access to care, how to find care for mental health. Having an EAP program established for your employees is a great way to open up that access. EAP is not just about mental health care, though. This program really is all inclusive. So, it offers support for caregiving support if you're caring for an adult, like a parent or an adult, or childcare support. It also talks about financial planning, writing a will, powers of attorneys. It really runs the gamut of services that are available to you. And I can definitely send out more information if you're interested in this program for your employees. Just to give you an idea, it's a very lengthy list of services that they have available. So another email I've been getting a lot, especially from our new municipal members, which I love that you're asking these questions early. So we're all on the same page for timelines and due dates coming up in the next few months. Because if you're anything like me, open enrollment is a very busy season. So having, those deadlines on my calendar already are always helpful to have. So these are some upcoming deadlines that are coming up for our municipal members. October 15th, which is next Tuesday, is the latest that you can have in a consortium plan change form. So if you're an existing municipality and you're looking to shift to a different plan or add a plan to your menu of options, you would want to make sure that that form is into us by next week. November is our open enrollment period. It's also when you would opt into any EAP program. December, we hope to have our MCAs out to you soon. We have not sent them yet because DFS has not approved our 2025 MCA yet. So we're still working on that. January is when everything takes effect, right? So plan changes are in effect, new municipal members are in effect. Members will already have their cards mailed out to them in December, so they're ready to go January 1. And then every year we have to have any directors or alternate directors sign a code of ethics. That will also come out from our clerk of the board, Lynn, early on in 2025. I'm going to try to skip through this a little bit quickly just so we can have an opportunity to hear from Brandon and Carl. But just to show you how much we've grown, this is the list of our municipal partners for 2025. And we are already talking to people looking at 2026. So just to give you an idea of how much larger the consortium has grown. So in kind of a backup to Amanda's question, what are the municipal expectations? So this kind of talks about what meetings are really required, bare minimum required attendance for meetings, the required employee engagement, such as you're going to host your open enrollment coming up in November. You're going to offer COBRA coverage to all employees leaving coverage. Unless you're a small group, we do that on your behalf. And required documentation submissions like the MCA and the Code of Ethics. I'm going to skip through my polls. I know you were really looking forward to them, but in the effort to conserve time, I'm going to skip on through them. So one of the things that I always like to point out is just because you entered it on the Excellus website doesn't mean it's all set. So when you send it to me, I do the data entry for small municipalities. And then what I do is go in and double check every entry I do the next day to make sure it's processing correctly, to make sure it turned correctly, or it's pending termination, to make sure that the plan has become effective or is pending being effective. So it's one of the tips I wanted to give to our large group municipalities to just make sure to go back in and double check that data entry to make sure it's processing. And during open enrollment, I normally do them in bulk, where I will just have all the subscriber numbers down and go in and double check to make sure it's all processing or pending processing. The other thing that we come across, especially with elections, we deal with a lot of elected officials, villages, towns. Just because the election happened doesn't mean anyone told the consortium that changes happened. So if there's changes in leadership, if there's a benefit clerk that retired, if there's a bookkeeper that's shifting to a different position and we need a new contact, you would go to our website under municipal resources. And in there, we have a contact update form. Just click on it, complete the form, and it sends to our clerk to update us. So we know we're contacting the right people with the right information. We've had issues in the past where maybe a bill isn't going through anymore, or we're inviting a benefit clerk that no longer works there. So they're missing trainings that would be available to them, different things like that. So it's always important to have that succession plan, making sure that we continue those connections with our municipal partners. We're always encouraging involvement in our committees. So if you are interested in serving in a committee, or you have a director interested in serving in a committee, we have vacant seats on most of our committees right now, especially when it comes to labor. So if you have labor groups like CSEA or DPW or things like that who may be interested in sitting on a committee, we would love it if they would email us for more information. Tips about newborns, just something
Hey,
to
Kylie.
remember.
God,
Yes.
I'm sorry. Is there a way to get a little summary of what each of those committees do?
Yep. Yep,
Thank
we
you.
have that written up. Yep. Just making a note here real quick. Tips about newborns. We do not need social security numbers to enter newborns. So all we need is their date of birth, and then they're always effective on their date of birth. The big thing is if you don't submit an enrollment form, then we can't make the coverage active. So a lot of times if you know someone's going out on maternity or paternity leave, they can fill out the enrollment form ahead of time and then call you with the date of birth while they're out on leave, so we can make that effective as quickly as possible. Otherwise, it ends up being like a backlog of coverage and claims that we kind of have to catch up on once they get back from leave, and then they're entered into enrollment. So just something to remember, we don't need social security numbers for newborns. This is going to be more helpful once I email it out to you. These are hyperlinks to all the resources you need to answer the questions in blue. So where's the benefit summary? How do I double check if my medication needs an authorization? How do I check to see if my medication is covered? And the expectation is to not assume that all benefit clerks are insurance experts. If you need us, call us. We're more than willing to help you with questions. I always say make sure the member at least called Excellus first to ask their questions before involving you or involving the consortium, because a lot of times it's a very simple phone call to Excellus where they can be quoted their benefits, or Excellus can check if their providers in network or things like that. Invoicing, processing, the big thing to remember here is we bill 2 months in advance. So please pay your invoices as they're sent, because then we always will credit back any overpayments. Don't short pay a month, because those changes, we don't apply it that way. So then there's always going to be like a catch up. So just something to remember. And then each bill comes with an Excel spreadsheet, which is your full roster for you to double check. So this is a nice double check. Oh, I termed so-and-so. Let's see if they're still on the roster. This is a great way to double check to make sure that your data entry is being processed, and that everything is accurate. Or, oh, so-and-so retired and I forgot to term them. This is a great catch for you as well. And these are just more billing tips, which I am just going to kind of skip right through, but just making sure that, you know, if it's an employee and spouse with coverage, you're not doing 2 individual plans. It would be family rate unless both people work for that municipality. We do have ACH capabilities. If you wanted to set that up, we would just need remittance emailed to us if you were sending payments via ACH. And we are looking at changing our billing mailing address in the next couple of months. Of course, we would send out multiple notices to you and your bookkeepers, but just wanted you to make you aware of that change that's coming, just to kind of streamline payments and premiums, so it's easier on our end at the consortium. And just something to keep in mind, we pull our rosters around the 14th, 12th to 14th of each month. So if you're doing data entry at, like, say, the 20th, it's not going to be reflected for several bills. So the sooner you can get your data entry in or your enrollment forms into me for processing, the better and more accurate billing we can have for you. And this is just a great way to stay connected. And I love saying this part. All of the benefit clerks who are existing members, I already subscribed you to the newsletter. And all the new ones, I probably will subscribe you as well. We send out a quarterly newsletter that has great information about the consortium, upcoming changes and updates. So just a very useful tool. Feel free to promote it with any of your members. Really, the more people that subscribe, the better connection we have with everyone. Sorry to fly through the rest of that. I just want to make sure there was enough time for Brandon and Carl. Are there questions about open enrollment? Are there questions about benefit changes, billing? anything like that. Okay, so on that note, I'm going to turn it over to Brandon, who's kind of just going to do a brief overview of our prescription benefit management through Excellus, just giving you some information about mail order pharmacies and things like that.
Thanks, Kylie. Am I sharing my screen?
If you can, if not, I have it ready to.
Yep, give me 1 second. Okay, can everybody see that?
Yep.
Okay, perfect. I can't see you guys now, so I apologize. And I apologize, I'm dealing with something congestion wise, so I'm apologize for the way that I sound, but I'll try to zip through this in the essence of time here. So as Kylie mentioned, just going to kind of go through some high level things in regards to the pharmacy benefit. For some of you, this may be new information. For some of you, this may be kind of a refresh of what we went through last year. So just taking a look at some of the items that we're going to cover: customer care, digital resources that are available, mail order, as Kylie had mentioned, specialty drugs, which Elon had mentioned earlier in the presentation, and then a couple of programs that we just want to make you aware of in case members come to you with questions on them, just so you're kind of aware of what they are and that they are legitimate programs if they're outreach to members. So when it comes to customer care, you are in our dedicated unit, or all of our Greater Tompkins groups and members are in our dedicated unit. So these are a subset of customer care advocates that are a little more seasoned and are working with only a select number of groups. So they know the benefits a little better. They're familiar with getting questions from members of Greater Tompkins. So a lot of times questions they've gotten, maybe questions that they've heard before. So there's less research that has to go into it, maybe able to answer members' questions, quickly and more accurately. So the same number that you or members would reach out to in terms of medical information on the medical plan side is the same team and the same phone number that members would call for prescription drug questions as well. That number is there in orange, and that is the same number that Kylie had referenced earlier in the presentation. And then I just threw up our hours there in terms of the dedicated unit, the hours that those advocates are available for questions from members. In terms of digital resources, creating an online account, I would encourage everybody to at least create an online account, create that login and password so members have access to their plan information 24/7. It is nice to have that information handy for self-service. Calling customer care, of course, is always an option, but I would imagine that most times if someone had an online account, they may be able to answer a question for themselves just going online without having to call in and wait for a customer care advocate. On the screen here, we just have a hyperlink, and this will be going out to individuals. I believe Kylie will be sending this out. A hyperlink for individuals to set up and register for an account online. It's very easy, and there's just a few steps here to consider as far as when you go to sign up for an online account. Once they're on that account, excuse me, there's a variety of things that members can do. View the pharmacy benefits and coverage, search for claims or look at their claims history, find a pharmacy, get their ID card, estimate out-of-pocket costs, track deductible and out-of-pocket spending, a whole host of things that members can do right there online. That's why I encourage everybody to at least register for an account. So if you do need access to that information, you'll be ready to go and be able to access it when you need it. This is just kind of a quick look at the prescription drop down. Once a member is logged in, along the top there, you'll see kind of different selections that they can choose. If they go to prescriptions, there's a drop down, and then you will see the list of kind of some of the things that I just talked about. that they can click on further, for information for really whatever they're looking for as it relates to prescription drug coverage. We do have a mobile app as well, very similar to, the online account that a member would register for on, the laptop or on a desktop, is available on the mobile app. To get the mobile app, you do need to register for an account. So you would need an online account registered before you could get the mobile app. But anything that you could do on the online account on a desktop or on a laptop, you can do it through the mobile app as well, and is obviously a very convenient feature, as everybody nowadays has their phones with them and 24/7 and is on them most of the time. So really information right there in the palm of your hand. Kylie touched on mail order. Mail order prescriptions are an option for members of the consortium. It's a very convenient way to receive your medications, if nothing else, simply for convenience. Most, if not all, plans have cost saving available when it comes to prescription drugs through mail order as well. Typically, instead of paying 3 copays for 90-day supply, which would be a copay for every 30 days, you're typically going to pay 2 copays instead of 3 for a 90-day supply. So you're saving 1 copay cost every 90 days. There are a couple of different options for mail order. Both Wegmans Pharmacy and Express Scripts are the vendors that we use for mail order. With Wegmans, you do not necessarily have to have a Wegmans in your area. Wegmans Pharmacy just has strictly mail order that you can utilize. I know Kylie has had very, very pleasurable experience with Wegmans in terms of their mail order service and their mail order pharmacy service. So when it comes to choosing between the two, it's strictly up to you. I know that Kylie has had a better experience with Wegmans. So I think typically when she talks to members, she does, kind of suggest Wegmans or push members to Wegmans because she's had better experience with them. But there are a couple of different options there for members that choose to take advantage of the mail order program. When it comes to specialty drugs, most of the consortium plans, or prescription drug plans, do require specialty medications to be purchased through our specialty pharmacy network in order to receive the drugs or receive the coverage. We partner with Accredo and Noble for specialty medications. So if you are receiving a specialty medication or are prescribed a specialty medication, in order to get that medicine, it would have to go through one of these specialty pharmacies. And this is pretty typical. If you are on a specialty prescription, you probably are aware of it already. If you are not currently, but you do get prescribed a specialty drug, you do try to fill that at retail. You will be notified that you do need to go down this path in order to get the drug. And it's a fairly simple process in order to set it up and receive the drug. And once you do, the specialty drug is typically mailed right to you as well. So it's something that you receive through the mail. You don't have to travel to an Accredo or a Noble Health to get the drug. It typically comes right to your home. And then just a couple of programs that we wanted to make mention of. Sempre Health is a text-based program that helps with affordability with drugs and as well as medication adherence. So making sure that eligible members, are able to afford their medication as well as take the medication. We identify members that are taking certain chronic condition medications and provide invitations to enroll in this Sempre Health program. We'll either send an email or Sempre Health will send an email if they have one on file, or just send a letter to the member just via direct mail to the residents to let them know about the program and let them know how to enroll if they would like to. Once they're enrolled, they automatically start receiving discounts at the retail pharmacy where they usually fill the prescription drug. Each time that they fill the drug, the copay will sort of reduce in essence. So they'll get text reminders when it's time to fill, and the discount increases every time. We wanted to make mention of this program. It is a voluntary program. It's not something that a member has to do. Although in today's day and age, there's a lot of spam calls that people get, a lot of things that people get in the mail that they don't think pertains to them or they think is junk mail. This is a legitimate program through the consortium, through Excellus. So if a member is reached out to regarding Sempre Health and they come to, HR or you at the group and say, hey, is this legitimate? Is this something that's real? Feel confident in telling them that, yes, it is a program that the consortium has in place, that Excellus works with this vendor, and, you're free to take advantage of it if you want. If you don't want to, you can simply ignore it and just go about, filling your prescriptions the way you have. So just wanted to make mention of that in case you get questions. And then another program that is technically not part of the prescription drug benefit, but is actually on the medical side, has to do with infusion-based medication. That is drugs that are typically administered in a facility or office setting. So a member would go to the facility, have the drug infused, and then go home. We have a program called our Site of Care program where we identify certain medications that are being administered in a higher cost facility, say in a hospital setting, that is available for home-based infusion. So there are companies that perform these infusions right in the care of a member's home. They don't have to leave the comfort of their home. They come to their house, they get the infusion. The home care company then goes on their way and the member doesn't even have to leave their house. Can be very convenient for members. There is instances as well where there may be a self-injectable formulation of that drug that may be available as well for self-injection, not just infusion. So in those two instances, we do outreach to those members to let them know of those options. Again, this program as well is completely voluntary. They do not, if a member wants to continue to go to the hospital to receive their infusions, they can simply, decline the offer for the Site of Care program and that home-based care. If it is something that they want to take advantage of, the representative that reaches out to them kind of helps them along the continuum of setting up that care, getting it administered right in their home. Some members really, really like this program and aren't aware that they can get the drug administered in their house. It saves on travel time and costs, whereas some prefer to go to the hospital and get it in that clinical setting. So really up to the member, but again, just wanted to provide kind of this commercial to you guys in case members come to you asking about a phone call that they received with this program, for you to let them know, yes, it is a program that is legitimate and is available to you, but it's completely voluntary. No one is, making you change to home care or self-injectable, but it is an option for you, and it's just us presenting options that are available to the members. That is all that I had. I can't see the screen, so I don't know if there are any questions that anybody has for me on prescription drugs or anything else.
Hey, I was just going to ask Brandon, thank you for the information. Are you going to be sending us that out? Because I always like to read it and be able to write on it as well. Are you going to send your PowerPoint out to us as well?
Yep, I can get that to Kylie, or she may already have it and she can, I think, send it out. Yep, with everything.
Thank you.
else.
Thank you for the information.
Yep,
Of course,
I
you're
do
welcome.
have that ready for the packet that I'll send out after the training. All of the slide decks will be included.
Any questions for me in the chat?
The only question was about Canna RX, if that program will continue, which obviously is separate from our Excellus prescription benefit. It's a voluntary prescription program to receive certain name brand medications at a zero copay. That program will continue on into the future. And if you need more information about it, feel free to email me and I can send that to you. It is only available to consortium enrollees and their dependents. I didn't see any other ones. So
Great, thank you, and thank you for bearing with me as I struggled through that presentation there.
thank you, Brandon, for hopping on and just giving us that brief overview. It's always nice to just double check some of those resources and information. So without further ado, I'm going to turn it over to Carl, who's like our go-to resource we have here at the consortium when it comes to protecting our cybersecurity. And he's just going to provide some great information for everyone as well.
Thank you, Kylie. Is it okay if I share my screen?
Yes, that'd be great.
Okay. Do this. All right. I'm assuming everybody can see the big screen.
Yes.
Awesome. Great. So I know that we are running up to the 3 o'clock timeline, so I'll be as brief as possible, but obviously with anything else, questions are always more than welcome. You can send them now, you can send them to Kylie afterwards, you know, whatever. We're more than glad to answer any questions. There's really only a couple of things that I want to focus in on. And first is the cyber news piece here. There's been a couple of areas where there's been some benefit issues, benefit administrators being hacked, their organizations being hacked. And there's been a lot of talk regarding the Change Healthcare data breach that is still filtering through all of its permutations out there. The last bullet you see here is there's a new Senate bill that's being pushed that will mandate additional fines and sanctions for individuals when they assess and say they comply with the laws and regulations for data security, specifically wrapped around HIPAA, but I can see it being, applied to others, including jail time. Okay, so they've actually added some potentials for jail time. So your cybersecurity program has to be something that is absolutely in place and has to be signed off by management, but it really needs to be able to be proven that it's in place, right? So that you don't run out into any situations where data issues or data breaches happen. I think everybody knows the internet isn't going anywhere. Everybody sends a lot of information across the internet. And unfortunately, the internet is also a place of all those black hats and those cyber trolls and everything else that's out there. The reality is small and medium-sized organizations are being targeted very often. So you need to be very diligent about your programs. You need to be diligent about who has access to what. And your vendor management side, you need to be very diligent about what your vendors have in place for data security and information security, and making sure that you have a clear understanding of what to do if you do have a question or something arises, or you do get one of those letters, or one of your members gets one of those letters, or an employee gets a letter that their data has been lost or compromised. So because chances are, there might be some questions that end up coming to you, especially if it's in their benefits program itself. Unfortunately, open enrollment time is also a significant time of data threats. The bad guys, I know that there's a whole bunch of data going back and forth. They come up with scams to trick people and sharing their open enrollment information with them. I've even had some situations where the benefits person was tricked by people sending them information to change their deposits to other banks and other accounts, which then the money was taken out of. So whenever you have an opportunity to validate something that doesn't feel quite right, it's kind of like, well, this person's always used this. Okay, now they're asking for that. Okay, making sure that you get back in touch with that person via another channel. Pick up the phone and call them, send them a separate email, do something to confirm it's really the person asking for you to make the change. And also telling all your employees and everybody within the organization the same thing. No one outside your organization is going to reach out to them for their benefits information or to change benefits or anything else. So if it's coming from somebody other than you, your employees need to be aware that it may not be an actual open enrollment. It might be a scam or something else. Smishing, I don't know if you've heard this term a lot, but a lot of this stuff is starting to happen during text messages too. So being sensitive to what's happening via text messages, including, hey, here's your new online enrollment form, here's the new way to get into our environment, those kind of things, making sure that they're legitimate is also going to be important and something to keep on the top of your head. Some protection that you really want to make sure that you're doing is never use the free version of any email system. Okay, there's no expectation of privacy with any of them, whether it be Gmail, Yahoo Mail, any of them. Okay, you want to always use the apps Okay, so the Outlook app, the Google app, those kind of things. And make sure that you if you're communicating with anybody to a free version, that it is something that they are aware of, that you're sending them private information, and they need to protect that information whenever you have a chance. Encryption is a fantastic safe harbor. So whenever you're using a computer and when you shut it off, make sure that it's encrypted when it's closed down. Okay. There's the Microsoft Defender and a couple other tools that go on Microsoft devices. Apple iOS has built-in encryption as well. So it's important to use that. Portable devices too, so your cell phones and your tablets and everything else, making sure that they have encryption. And then whenever you have a chance, being able to use email encryption when you're sending private or personal information to people outside of your organization that might be going across the public internet, not the private email that's you're emailing to an employee, but maybe you're sending it to one of their guardians or somebody else that needs to be communicated with. Make sure that you have an opportunity to encrypt that. And then your passwords, passphrases, so those long, complex phrases. So my favorite place to go in the world is Portugal. You know, turn that into a password, so the passphrase. That's much, much more difficult than a regular old, 8-character with a couple of special characters and everything else. And then MFA, multi-factor authentication. Many of you probably see that with your banking relationships or your TPAs or others, where you're asked to put in a password and then something else, a code, identifying yourself through a picture or some other prompt. That's that multi-factor authentication.
Carl, I just wanted to mention in the comments section in the chat, you have some comments. So from Denise at the City of Ithaca, we had that happen at the city. We received an email to change someone's direct deposit. Thankfully, this email went to multiple staff and we contacted the employee. It was a scam. So we told the employees to change their direct deposit or banking information. It had to be brought in person to the HR department.
There you go.
Another mention was from a town clerk. We've had it happen often, and same, we make them come in and fill out a form to change anything.
Cool. Yeah, so it is happening amongst us as well. So that's always a challenge and something to be very aware of, especially this time of year. So some key items, be skeptical. What's that old term, caveat emptor, buyer beware. If it sounds too good to be true, it probably is. When you get that text message from Venmo, they want to give you $500 for filling out some survey or something. Yeah, don't do that. Okay. Now one of the more recent scams is you get something in the mail, a gift, and it says to to implement your warranty, scan this QR code, and that QR code actually ends up putting software on your cell phone or your tablet or something that takes control of it. So if you do your banking on your cell phone, your banking on your tablet or something else like that, they now can see everything that you do. So if you get some gift in the mail that you never asked for and no idea where it's coming from, just be skeptical before you click anything that's a QR code or something else in there. Your passwords, don't share them. Okay. That's always a good idea. Keep your software updated. Don't make, when the patching notice comes up on your computer that says, do you want to patch now or wait 5 minutes? It's okay to wait 5 minutes, but just don't keep hitting wait. Okay. So you do want your software to be updated. Okay. And then remember, be active part of your security strategy. If you have a question, if something pops up, if somebody wants to ask you questions regarding how you protect the information, it's okay to share that kind of information. It's okay to be part of that environment and talk about that. And one key item for every organization that has protected information, whether it's HIPAA, whether it's Department of Financial Services, whether it's healthcare, whether it's employee information, social security numbers, FSA, HSA, anything else, all of those laws for the data protection and the cybersecurity require a risk assessment. Make sure you're getting them done at least annually. So that's a big one. So I ran through that really fast because I didn't want to keep too very long. So if there's any questions, I'd be more than glad to answer them.
One of the things that we have come up at the consortium is when a benefit clerk reaches out to me to look into an issue for a member, they obviously want to give me the member's name, but I normally encourage them to send the numbers of the subscriber ID rather than date of birth, because otherwise they should really be sending that encrypted. What are safe ways to communicate that type of member information, including like our enrollment forms contain dates of birth. So I normally encourage them not to email them, but to submit them through our secure portal that goes through a firewall and all such through Tompkins County.
Yeah, whenever you have a chance, a secure portal is best. So that's always going to be encrypted natively. So that how the software is put together, the SFTP, the portal, the VPN, you got the lock on the URL code when you put the thing in there. That's all of those secure connections. If it's something that is incredibly time sensitive and needs to be taken care of, the best way to keep something secure is to pick up the phone and call. Okay. But in a normal day-to-day effort, the normal way to go through processes is to use the portal, a secure portal. Okay. But if there's some urgency associated with it, Kylie, just best to pick up the phone and just talk to people at that point. So I did see a question jump in there. Unfortunately, it disappeared before I could read it.
Yeah, the comment from Denise was our IT department told us to not save our data on a website and to always type it in, especially with banking information. I think we kind of talked about this too, and we had our risk assessment at the consortium as well. Something you don't really think about is all those passwords that you save.
Right. So there's secure websites and there's non-secure websites. Okay. So when you communicate with a secure website, the bar or the URL is either going to be green. Sometimes there's a little lockup there. Okay. So utilizing a secure website and a secure connection to transfer information in this business environment that we're in, and the information that has to be transferred back and forth for benefits planning, for COBRA, for whatever. Okay. That's the best way to do it. Okay. I know that we have the secure site. Typing information in there is fine. Okay. What you don't want to do is go from your Gmail to some other private or public Gmail or Yahoo or something else and send some forms that way, because there's no expectation for privacy on those free services. Okay. The consortium has an application that they utilize that is a paid application for that back end on the portal, so that they can control the security on that. So. So I absolutely encourage everybody to reach out with any additional questions. Obviously, your internal organization is always your first stop if you have a cybersecurity or data privacy question. But if you have something you wanted to bring up at some point in the future, Kylie has my email information. I'm more than glad to answer anything. Don't send breach information via email. If you have a data breach, that's never something you want to put in email. My favorite attorney always tells me email equals e-discovery. So if there is something that you have with a data breach or some other information like that, that's not something you want to share via email, even if it's a secure site or a secure email system. So, but if you have just general cyber questions or whatever, I'd be more than glad to answer them.
All right, thank you so much, Carl. So Carl was our last presenter, so that kind of wraps up our benefit clerk training for open enrollment. Please reach out to me or Elin if you have any questions. I will be following up with the slide decks that were contained in all of the presentations, as well as a recording of today's meeting. There was a question in the chat that says, what is the best site to use for sending a secure email? Carl, if you might want to answer that one.
Okay, so there's the best site to use to send a secure email. If you have Outlook email, or if you have the government version of Gmail, or the not-for-profit version of Gmail, those kind of things. When you communicate with those, there's a way to send the message encrypted, usually built right into the bar up on top. You click a button and it encrypts the message and encrypts the information in it. Or sometimes the organization can use a tool like MX Encrypt, Brightmail, other things like that automatically encrypts things. Okay, so check with your provider, your IT team, or your IT service organization first. And then if you don't find something, you need to just ask them, hey, we need to be sensitive to our email encryption with sensitive information we're providing. What would you suggest?
Thank you, Carl. So thank you so much for joining us today. And I will send that follow-up email with those resources, but of course, just think of us as a resource as well. Feel free to email or call with any questions or follow-up. But thank you so much for joining us today.